My own sister died she's a nurse, and she died of pneumonia that she contracted after minor surgery, gastric surgery she had at Park Plaza Hospital 25 years ago, when she was in her early 50s. 2 days after she was discharged from the hospital, she died of pneumonia, and she contracted it there, and it was a drug-resistant type, and she died in the emergency room. So I got a very direct stake in this. The other people I've known all have some sort of story like that. And you don't have to go far. I talked to the physician who was the head medical director at Memorial Southwest Hospital in Houston when I first read this information. It was in a long paper called Death by Medicine, which you can Google and look up and read yourself. But I asked him, I said, is this true? Is this really true? Do we really have 783,900? Because your share of that at this hospital looks to me to be about 150 people a year. That's what it looks like your share is. And he said, Don, I think it's worse than that, at least at his hospital. I think it's worse than that. And I was working with him at that time to establish a team of pulmonologists, 8 of them, to act as the exclusive physicians in ICU at Memorial Southwest Hospital, because they wanted to try to get the death rate and the infection rate under control at that hospital, and the only way they could do it was to restrict access to the ICU to just the physicians who were the specialists in covering it and who were the most capable of making decisions about taking care of people, because they had line infections and pneumonia and staphylococcus and accidental deaths and drug deaths right in that hospital, and they knew it. And it took them 1 year to get the medical staff to agree to let it be a specialty group of pulmonologists that was doing it and not anybody on their staff. So they keep all the physicians out of ICU except those 8, and they man it 7/24, and it works. It killed off all of their problems in control of deaths in ICU and infections in ICU. All right. Now, the insurance black box. See, these are just manifestations as to why these things are black boxes, right? Unpack them. Let's see what's in them. So this is the first indicator that insurance is a black box, because what you see on the left, the Medicare and commercial rates, that's how much for taking care of one patient for 1 month. All right? That's the average cost of one patient for 1 month based on little over 25,000 claims that we have in our database for both commercial and Medicare patients in Houston, Texas. That's what it costs. It costs $395 to take care of a Medicare patient and $159 to take care of a commercial patient, and that's paying the doctors without reference to coinsurance or deductibles. That's what the cost is, and that's paying doctors what they expect to receive for working. That's what it is. But insurance charges for the same costs that we're paying for medical care on the right-hand side are $730, and that's what Medicare pays to somebody to pay the doctor, all right? And $295 is what Aetna charges you to buy insurance from them to pay the doctor the $159, the doctor and the hospital the $159. That's a disaster. That's a disaster. That's why we're having fights about medical care in the United States and medical insurance. It's because there's no willingness to look at the underlying facts and the underlying conditions of insurance and health care in the United States. There's no honesty in the system. None. Zero. And there's not an exaggeration. All right? Check out the financial progress of the major insurance companies in the last 10 years and see what's happened. He made, for one company that he works for, the patients that enrolled with him, they made how many millions in 1 year from your business?
My first year, we made a little over $100 million.
100 million. And how many patients did you sign up for?
About
20,000 patients, $100 million. That means they charged $100 million more than they paid out for medical services and for their own administrative expenses and sales expenses on 20,000 people. How many people in the United States? A lot. 300 million. So it's a big number. And that's the reason it's so hard to get anything done to change the system the way it is right now. To look at it in an honest, from the floor up basis.